So Barbara, you're here today. How many weeks after I did your surgery on your plantar fasciitis?
It's 6 weeks.
6 weeks. And you told me you just got back from a long
long
trip.
yes.
And you did a lot of walking.
Yeah.
And a lot of sightseeing, and your feet were not bothering you, right?
That's right.
And you came to me how many months ago? But what, 6 months ago?
Oh,
maybe even longer, right?
Right.
And you had severe heel pain, and from what I remember, I was not your first opinion. You went to see a couple of other doctors, right? And we have tried absolutely everything in the textbook before we decided to do that new Tenex procedure.
Absolutely. We did the shots, we did everything, and I wore the orthotics for years, 4 months trying to live with it, and it was just extremely painful.
Right, and you know me, I think by now, that I'm a big believer in non-surgical treatment, and surgery should be last resort, but luckily we have this new procedure. It's called Tenex procedure. And remember, our biggest thing was, should we do it on both feet or should we do one at a time? And they tell us that if you do both feet at the same time, it takes a little bit longer. So which means 6 weeks is for one foot, but for both feet it takes a little bit longer because you don't have a good foot and a bad foot. It's, basically both feet have to heal. So, but I recommend it to do both at the same time because it's not a very long procedure, and I have a hard time justifying putting somebody under anesthesia twice, because can you imagine doing 6 weeks two times?
No.
Right, it's very difficult. And I'll give you an example. My mom, she had total knee replacement, one at a time. Well, she had one and she never got to the second one.
Right.
Right, because it's very difficult and it's a commitment. And you know how you had to go to physical therapy, you still had to do your due diligence. So I think you made a right decision, and look at you, you're sitting here 6 weeks.
I'm very excited because I'm very active. I do a lot of yard work. I'm outside an awful lot, and I could not have done this, and I've tried all the shoes.
Right.
This is the way to go, and
Right.
the least amount of downtime.
Right, and remember how with you is you've done your research extensively, and I told you that the reason why I absolutely like Tenex procedure, and as I told you, it's a procedure that was introduced by Mayo Clinic, is that it preserves the anatomical alignment of the foot, and we do not cut the tendon, because the biggest issue I have is, Mother Nature created it for a reason, and then you go and you cut it, and you basically will develop arthritis later on. So you're trading one problem for another problem. And for the first 15 years of my practice, that's the only procedure basically that existed. So even though I did not like doing it, but in situations where people were in severe pain, we had no choice. But it also carried very unpredictable results. Tenex, great results. It's never 100%, but having a procedure that gives you over 90% success rate, that's remarkable. In medicine, looking at the most successful surgeries being cataract surgery and a hip replacement surgery at 98% success rate, having a procedure that carries over 90% success rate, and it never makes it worse. How wrong can you go? Right? As long as we have a backup plan.
Right.
So.
Well, I'm very happy, and the downtime that was minimal considering what I could have been stuck with, and also I didn't have not a lot of pain or anything. The orthotics, if you do what you're supposed to do,
right,
it's pretty much
right. Exactly. You know how I told you, it takes
and
me, you, and the guy above.
Right. Absolutely.
So, well, thank you so much. Thank you.